Melissa Seidel. There we go. Recording in progress. I'm Melissa Seidel. I'm a public health strategist with the Milwaukee Health Department, and I'm focused on maternal and child health. And I also coordinate Milwaukee's FEMUR team, which is Fetal and Infant Mortality Review. And I am spearheading this action team for maternal and child health. And so I will have my co-hosts on here start the introduction. So Rosa Maria, if you would like to go next.
Hi, everybody. I'll echo what Melissa said. Thanks for being here. I know it's not looking so great outside, but so I'm Rosa Maria Martinez. I am the Maternal and Child Health Director here at the Milwaukee Health Department. I've been here for a couple of months and oversee a variety of programs from doulas to empowering families to WIC. So variety, I won't go through the whole list, but variety. So welcome and thanks for being here.
And
with
Alex,
that, could I?
Oh, sorry. I was going to
nope, that's exactly what I was going to ask you.
I was going to go down the list so that none of us have to worry about calling on other folks or figuring out who's going next, just make it nice and easy for us. So Alex, if you'd like to go next.
Yeah, hi everyone. My name is Alex and I'm a new public health strategist with the Milwaukee Health Department focusing on health equity. My role in here is to help all action groups of MKE elevate and incorporate health equity into their action plan and to any future vision. Melissa, I'm also going to do the poll about community sectors while we're going through this.
Yes, there may be a little cat coming through some of those videos. He's expecting his treats right now. So that poll might pop up on your screens. That's just to get us a little representation of what types of organizations are present in this meeting. So whenever that comes up, you can just answer that. Kong, if you would like to introduce yourself next.
Yep. Hello, everyone. My name is Kong Zhang. I'm one of the data and evaluation coordinators here at the Milwaukee Health Department under data team. And I will be helping Melissa with some Zoom logistics, running the chat, keeping notes, and other agenda items that she may have. So,
thank you, Kong. Cameron, I believe I saw you join.
Yeah, I'm here. Hey, everybody. My name is Cameron. I'm a public health social worker in the Empowering Families of Milwaukee program.
Thank you to my team there. I realize I could have said this for our team, but for all the rest of the folks, real simple, name, your role, your agency or organization. And I would love to hear something that you are looking forward to in being a part of this action team. If you have repeat answers as some other folks, that is absolutely okay. So at the top of the list is Akatalamsma.
Hi, good afternoon. My name is Akanel Tansma. I'm a faculty professor of nursing at the College of Nursing at UWM. Really excited to be here and meet everyone and meet some familiar faces from a meeting we had in November, sharing our work where we're focusing on analysis of peri data and using that to find issues in the community and addressing that. And then on the intervention side, working with community workers on an app, Maternity Metrics, to bring reliable clinical data to frontline users to help and support healthy pregnancies in the community through supporting social networks. Thank you so much. Looking forward to working with you.
And Benjamin Porter.
Hey everyone, great to be here. Hope you hear me okay. I'm not coming off video because I'm on my cell phone. Spectrum doesn't like bad weather. I am the Health and Health Equity Program Officer for the Milwaukee Foundation. That includes Healthy Birth Outcomes funding priority. And I'm really excited to continue the work to build momentum around a movement to end the disparities in our birth outcomes that are completely untenable.
Allison Chavez-Stewart.
Hey everyone, I'm Allison Chavez-Stewart. I use she, her, aya pronouns. I'm the bilingual director of community relations for Planned Parenthood of Wisconsin. super excited to be here. I'm leading a team that's working on implementing our community-centric business model at Planned Parenthood, where we're really trying to connect our patients locally with resources that will help improve, that will help serve the needs that they specifically have in different communities around the state, but also to increase health equity and improve health outcomes. So this is a super important issue that we're trying to connect with other organizations and lift up work that other people in the city are doing and help our patients, obviously. And excited to see some of my colleagues on here.
That's great. And Christina Drain, you want to do a quick intro of yourself? You're muted.
Muted. Hi, I am Christina Drain. I am the City of Milwaukee Bomb Doula Program Manager. Our doula program offers free doula services to anyone who lives in the City of Milwaukee and less than 30 weeks pregnant.
Let's see, my list keeps jumping around a little bit. Christina Veiling.
Hi, everybody. My name is Christina Vealing. I'm a doula with the Milwaukee Health Department Bomb Doula Program. I'm just looking forward to really focusing on how we can improve healthy birth outcomes for the babies in our city and community.
Claire Piahowski.
Hi, everyone. My name is Claire. I am from the Wisconsin Women's Health Foundation, and I do work with breast cancer and lung cancer disparities and decreasing those in Wisconsin. And I'm really looking forward to, I think, mostly just learning about the accessibility piece and looking at the equity piece and learning from all of you as well.
And I think we've had a couple new people join, so we are recording this meeting. You're welcome to put your video on, but you do not have to if you're not comfortable. We're doing quick introductions, and Deanna Tharp, you're next.
Good afternoon, Deanna Tharp, Director of Wisconsin Doulas of Color Collective. We were established in 2014, and we are here to serve our community.
Eddie Kennedy.
Hi, my name is Eddie Kennedy, pronoun they, them, and I am here with the Planned Parenthood of Wisconsin as our outreach coordinator. And I'm also here with the Parenting Network and UW School of Public Health as their outreach research specialist. So with my work with Planned Parenthood as a community outreach educator, I work in their education department, connecting the community to our resources, as well as providing education to various different community organizations, schools, entities like that. And with the Parenting Network, I work with a professor collecting parent information around their experiences with parenting and connecting them to parent resources. So that's anything that revolves around the health of their child, any type of childcare access programs for teaching parents, programs for parent support, and things like that.
Two hats, love to see it. Erica Olivier.
Hello, can you hear me?
Yes.
Wonderful. Good evening, Erica Olivier. I'm the Deputy Commissioner of Community Health with the City of Milwaukee Health Department. I oversee various community health programs in tandem with Rosa Maria Martinez, along with being a part of the executive cabinet of the Commissioner of Health and really trying to mobilize specific, mission and visions of the health department that tie into the social determinants of health, and more specifically how it's tied into infant mortality, maternal morbidity, and things like that. And we're really looking forward to how we can re-envision the health department's role in, convening and action planning spaces, and just really increasing the collective effort, and not just collective convening, but really how are we seeing outcomes come out of these spaces. I think a lot of us are used to being in different types of factions and collaborative efforts of sorts, but I'm like, can we get some outcomes? So that's kind of the long and short of it from my end, but very happy to be here and happy to be a part of this team. And thank you to all of our maternal child health focus folks that are steering this initiative. So yay.
Thank you. And Heidi Katz.
Good afternoon, everyone. My name is Heidi Cotty. I am the program chair with Milwaukee Area Technical College Nutrition and Dietetic Technician Program and Community Health and Nutrition Navigator Program. And my areas of interest in this committee are twofold. First, specifically in nutrition, of course, my trade and expertise is as a registered dietitian in the field. So that is my area of expertise, and that falls inside of the Maternal and Child Health Initiative action team that we have here. We have a new Community Health and Nutrition Navigator program that from the academic planning and long-term, just to piggyback off of Ms. Olivier, I apologize if I'm pronouncing your last name wrong. Comments regarding wanting to see results and what that looks like in the long-term plan. Our community navigators can be placed into the community to assist in our members achieving some of these goals, our community members. So that's one component. I also wear many hats at the college, and other of which that I'm a part of is in our Holistic Health and Wellness Committee, and I'm a part of the Housing and Food Security Subcommittee. And inside of that work, we're looking to expand the access of healthy food to our students and offering food pantries and the like inside of the college space, but also identifying spaces that our students potentially could assist in achieving some of those outcomes that she spoke of, and service learning opportunities and so on and so forth. The other piece, I'm excited, I wrote down Christina Drain's name and the work. I didn't write down the other doula's name, but I'm working to develop future potential curriculum for doula programming as a certificate or technical diploma, for approaching it from an academic future training of future health professionals to assist in this space. So that's what I am hoping to have conversation around as a part of this group.
And next is Gina Holt.
Good afternoon, everyone. So I'm Gina Holt. I use she, her pronouns. I'm a family nurse practitioner and nurse scientist at UW Milwaukee College of Nursing, working closely with my colleague, Aknil Talsma, with the PERI data, as well as the development of maternity metrics. I'm most excited about how we can use clinical data and community wisdom to inform and prioritize interventions in the city.
Next is Jen Babcock.
All right, good evening, everyone. My name is Jen Babcock. I use she, her pronouns. I work for Planned Parenthood of Wisconsin. I'm a nurse practitioner and lead clinician with the organization. So I do a mix of seeing direct or doing direct patient care in our health centers in the Milwaukee area, as well as doing administrative work and working with amazing people like you to see how we can better assist our community.
And Chris Paterka.
Hello, everyone. My name is Chris Paterka. I am with iCare Health Plan. We are a Medicaid health plan. I'm a nurse by background. I do population health strategy here for the plan, and we work very closely with a lot of our pregnant members, and really excited. I know we've been working for a long time to support our pregnant moms in the city, and we have our pregnant people in the city and have a lot of work to do and continue to. So I'm looking forward to working together and hopefully agree. Let's get some outcomes and make some change. We have a lot of opportunity. So I'm glad to be part of the group. Thanks.
Lindsay O'Connor.
Oh, she put a note in.
Oh. Yeah, my internet's not good.
Got it. All right, so Lindsay works for the health department as well and wants to learn more about the work that we are doing in this area, specifically related to health disparities. Hopefully this will be a good meeting for you there. Marlene.
Hi, everyone. My name is Marlene Zahran. I am the perinatal mental health specialist here at the Strong Baby program at the Southside Health Center. Yeah, it's good to be here.
And Morgan Miller.
Good afternoon, everyone. Today I am here as a community member. I am a registered nurse by trade, and I have a huge interest in public health and maternal child health. So I'm just really interested to see how the health department is moving forward in this area, in this topic. I'm happy to be here.
We're glad to have you here. Rachel, I believe you also put something in the chat.
Yeah, I can say something too, though. My name is Rachel. She, her, hers pronouns. I'm with NAMI, the National Alliance on Mental Illness, specifically in Milwaukee County. And I'm just here to support what you're doing. You know, mental health is important, but health is important. Health equity, all the things.
And Robert Walker.
Yes, good evening. Robert Walker. I'm a public health strategist with the City of Milwaukee Health Department. My focus is mental health and community resiliency. And one thing that I'm looking forward to is building partnerships for initiatives for the greater good of the city of Milwaukee. So I look forward to meeting you all and working together for the greater impact.
Sumaya Clark.
Good afternoon, everyone. My name again is Sumaya Clark. I serve on the executive cabinet for Milwaukee County Department of Health and Human Services as the director of systems integration. And I'm really excited to be here for a few different reasons. I'm interested in opportunities to collaborate better around strategy, shared priorities. Maybe there's opportunities for funding so that we can improve the health outcomes for children, youth, and families in Milwaukee County. So looking forward to working with you all.
Teresa Ortiz.
Hi, good evening, everyone. Teresa Ortiz. So I'm here sort of in two roles. So I'm the public health manager for the Cudahy Health Department, but part of that is we have the Title X Reproductive Health Clinic, Third Coast Clinic. So I'm really here kind of representing that. Many of the patients we see there they reside within the city of Milwaukee. In addition, I'm a PhD student at the Zilber School of Public Health and a project assistant with the Maternal Child Health Catalyst program there. So I'm just really excited to be reconnecting back with the maternal child health world. I worked in maternal child health for over a decade, and I'm just very excited to sort of kind of going back to Erica's point earlier, coming back together with this group to see what we can do as far as outcomes. Also really interested in kind of working through what we can do at the systemic and institutional level to address all those things that really truly impact our moms and babies. I'll just say it lastly too, I'm also here as an auntie. I have 3 nephews born and growing up in the city of Milwaukee, so it's really important for me to make sure that they have every possibility to grow up happy and healthy. So I'm grateful to be here.
Awesome. And Trina Solomward.
Hi, I'm Trina Solomward. I'm an associate professor and social worker at UW Milwaukee. My research area has been improving infant and maternal health outcomes. And so I'm very excited to be here, as I think Robert said, connecting and building partnerships and supporting efforts to improve the health of moms and babies in Milwaukee. Thank you.
And Zachary Wilkes-Matrew.
Hi, everybody. This is Zach Wilkes-Matrew, and I am here with the American Heart Association. I am the Community Impact Director, and I am just curious to see how AHA can support the initiatives in this group.
And anyone else who maybe joined a little late or who I possibly missed, feel free to unmute and introduce yourself.
Hey everybody, I'm Monica. I am also a public health strategist with the health department. So I'm working kind of across all of our action teams, and we'll be working with our steering committee. Excited for a lot of reasons, kind of similar to what others have said. I previously actually worked with our FEMA program and had been a part of the Life Course Initiative. So I'm really excited to see some collective effort picking back up again to improve healthy birth outcomes. It's exciting to see some doulas on the call because when I was working in FEMA, we didn't have doulas. So it's nice to see some advancements that have happened, and just excited to see where we can go together. So thanks everybody.
Awesome. Thank you so much, everyone. I am going to screen share again and bring back that PowerPoint slide. So again, you are welcome to keep your video on or off. That's your choice. I will just be here speaking into the void either way.
Melissa, do you want to share the results of the survey?
Sorry, Alex, do you have that on your end?
You mean like who's in the room? That community factor survey?
Yeah, is that what you meant, Rosa Maria? The poll for our kind of representation?
Share that. Are you guys seeing it on your end? Perfect.
Alex and I are sharing an account right now, so I am not seeing it. Glad that you all are. I have the registration list, so I can just look at my spreadsheet of all you guys, though. That's all right.
Yeah. So it's about 39% government, about 9% community member, 22% education system, and 9% medical services.
Seems like a pretty good spread there. And I know there are some other folks who just weren't able to join the meeting today as well. So I think once those folks are able to join in future meetings, we'll have even more diversity of representation there.
Yeah, to include social services and advocacy groups.
All right. See, every time I stop sharing, it shows me 3 PowerPoints, and I don't know what all 3 of those are. So I need to get rid of those spares real quick so that I just have the main one. There we go. And are you guys seeing the PowerPoint so far?
Yep.
Yep. Now we're seeing your notes. There you go.
All right. So we have, let's see here. Actually, I somehow duplicated it. I had this so well practiced right before the meeting, and of course it does not go quite so smoothly. That's all right. I will just go through and my support folks, if I'm missing anything, just hop right off mute and let me know. So
when you go to the options, Melissa, you can you just click instead of you hit duplicate instead of
and now my
swap.
screen share toolbar is blocking me though. It won't collapse. Yeah. That's all right. I always give myself well-explained PowerPoint slides so that I always am cueing myself with what's going on. So I figure we need to start with an overview of MKE Elevate. Not everyone may be familiar with the program. I know I've tried to have meetings with a lot of you, but not all of you. So MKE Elevate is kind of the branded name of Milwaukee Health Department's CHIP, and a CHIP stands for a Community Health Improvement Plan. This is a community-driven plan and agenda to elevate the health and well-being of Milwaukee residents. And another acronym for you is the CHA, that is the Community Health Assessment, and that is the data evaluation side of things. And so we use that data to inform our Community Health Improvement Plan and create this framework for MKE Elevate. Those green highlights are links there, and those links should be available for you in the agenda that I sent out with the email if you would like to reference them later. This is a timeline of our activities with MKE Elevate. So last summer and fall, we, as the health department, did over 2,000 surveys to Milwaukee residents to help identify health priorities. Those were conducted at dozens of community events, festivals, block parties, farmers markets, a wide variety of events spread throughout the city to try to get as representative of a sample as we could get. We also had a photo voice contest where folks could submit photographs of their view of the city and highlight what they saw as healthy or unhealthy in the city. And we got 86 submissions there. And then in the fall, we held 4 community meetings to present the findings of those surveys, as well as the community health assessment, that data portion. We presented those findings, and then we gathered additional feedback at those community meetings. And so now in 2023 and moving forward, we identified our top priority health issues. We conducted outreach to community partners, and that's why we're all here. We're forming these action teams around those health priority issues. We've also been identifying folks to be on a steering committee to kind of be the umbrella that is over this whole process. And then we are planning to release the CHIP plan at the end of March of this year. So that is going to have our mostly final draft language that we are going to put on the website for folks to start seeing. So those health priorities that we identified, 3 categories really rose to the top: safety and violence prevention, the built environment, and maternal and child health. So this graphic you can see on the right has those 3 categories on the inner ring, and then around the outer ring are the kind of subtopics within each of those, because these are all pretty big topics. There are lots of components to each of these health issues. And within the center of that is racism and health equity. That was listed on the survey as one of the possible health issues, and that was one of the top results that respondents selected as being a major health issue in Milwaukee. And rather than giving it its own action team, which felt a bit siloed to us, we made it the umbrella concept that is going to reach over all of the action teams. So that anti-racist lens and that health equity lens is going to infuse all of the work that all 3 action teams work on. And then again, that steering committee is going to serve as a resource, a source of connections, and kind of a guide for the action team activities. So those action teams, the goal is to collaborate together with the other members, align the work of all of our agencies and coalitions with the goals, objectives, and strategies. We all know there's lots of work being done around maternal and child health in Milwaukee, and so this is a way for us to kind of be in alignment with each other on that work. We can work together to implement some of the strategies that we do identify in future meetings. And at these action team meetings, we can share updates with each other on progress we're making. We can share upcoming events or opportunities, coordination. We can participate in each other's advocacy campaigns. This can be a team for each other to share. And then we can also contribute to evaluation and ongoing monitoring. Some of that, seeing those outcomes, does involve the evaluation and the data side of things. So we are going to try to stand up some evaluation components. The role of the health department here is really to be a convener. We are the room, physical or Zoom room, for everyone to come together and share space with, so that we can share our data, we can identify priorities, we can brainstorm and come up with interventions down the line, all in the room together. Again, alignment, making sure that existing plans and strategies are coordinated, making sure we're all working together in the same direction, not going in opposite directions, not duplicating. We want to help facilitate things and guide the conversation and bring in additional expertise where it's needed, for example, from that steering committee, or just be the one to help the conversation move along. And then again, measuring and tracking progress with those metrics so that we can assess the outcomes. So, any questions about that overview of MKE Elevate? Feel free to go off mute, because right now I only see Rosa Maria in the corner. Seems that we're all good. I will keep us rolling. we're going to go into our goal setting portion. And so I'm going to emphasize this a couple times. We have a 5-year time horizon. MKE Elevate works in 5-year cycles. And so that is kind of our timeline for where we can have an impact. So what do we want to achieve in 5 years? And also what is possible to achieve in 5 years? In a little bit, we are going to be splitting up into groups, and we're going to each be focusing on a few different of those specific health topics within maternal and child health. But first, I wanted to give us a little bit of data context around maternal and child health in Milwaukee, both the city and the county. So as we know, infant mortality is a big issue in Milwaukee. That disparity there on that chart is extremely stark. We have a big, explicitly racial gap in the infant mortality rates, with Black and African American people being far more affected than any of the other racial or ethnic groups. We also have some other indicators. Birth rate by C-section is at about a quarter of all births. The premature births are at 13% for the city, 12% for the county. Low birth weight is rather similar, 13% for the city, 11% for the county. And then that first trimester prenatal care, that is just under 64% for the city and just under 69% for the county. And so if we notice, those rates are fairly similar between city and county, but just that slight bit better when you factor in the rest of Milwaukee County. A couple other notes, the racial disparities, while only highlighted here for infant mortality, they do exist across all of these metrics, with African American and Alaska Native / American Indian folks faring worse typically than the rest of the racial and ethnic groups. Age also has an impact, with people under 19 or over age 45 typically having worse pregnancy outcomes. And then the trends, I don't have the trend lines on this presentation, but they are available. If you see those links below, those are again shared in your agenda. The trend lines for these have, in general, been getting worse since 2015, and in particular, preterm birth and low birth weight have been getting worse in that time. So those subtopics that I mentioned before are healthy birth outcomes, reproductive health care access, nutrition, and maternal mental health. So these were identified from those surveys that we sent out as kind of the top topics within maternal and child health to be priorities. And so we should have another Zoom poll getting ready. Are these the 4 right topics? I know that's kind of a loaded question. Do these feel right? Do these feel wrong? Are we unsure? This is something that we might not be able to, if we want to make changes, we might not be able to make that happen in this meeting, but we can at least see what folks are thinking. So we've got the really big bucket, healthy birth outcomes. We have that healthcare access component, and then we've got nutrition and mental health. So again, since we're sharing an account, Alex, I can't see if you've put the poll up, but go ahead and launch that poll if you haven't already.
It's been up.
Thank you.
About 15 people, 17 people have answered so far. So we're just waiting on, I think, 2 more people. All right, well, it looks like we slowed up. So 20 out of the 24 participants, about 60% answered yes. So 62, sorry, so it is answered 62% yes, 5% no, and 33% unsure.
Sounds good. If anyone has anything they'd like to share in the chat around that, you can feel free to do that now. Otherwise, my contact information is going to be shared at the end. I'm just going to check my clock very quick. Does anyone want to real quick, kind of pop in right now if you have some quick thoughts about what you think is missing or what's just not quite right.
Hi, this is Akenel Talsman. When we've been working with community workers, we heard a lot about safety, violence, the importance of pregnant women to know what to do. And I know you have it as its own overarching topic, but wonder if it also should be threaded through this area.
There is certainly space for lots of overlap between the 3 action teams that we're going to have. So we've got nutrition here, and similarly food access is a part of our built environment action team. So there's definitely crossover. Not to put you on the spot, Robert, but some of those subtopics that you have in safety and violence prevention, are any of them around interpersonal violence or safety, or anything where we could establish a bridge kind of in between our action teams?
Yes, we are in the our category of the safety and violence prevention. We do have a section around interpersonal, and so there is opportunity for us to do some collaborating around action teams, and that's something that we could definitely visit as we continue on with our meetings.
Thank you, Robert. That's very helpful. So this is something where once we get into the brainstorming, there will be space to identify 1 to 3 goals for each of these subtopics. And in that brainstorming, you are, of course, more than welcome to bring forward those issues that you think should be a bit more prominent. And as we go through the notes, because we are going to be recording all of the brainstorming that we do, we will identify those spaces for collaboration and for work across the teams there. So definitely feel free to make sure that gets recorded. I mean, we can build those bridges that way. So to get our creative juices going a little bit, there's a visioning activity here for us. If you've got some paper or a note on your phone nearby, you can feel free to record it. Otherwise, you can just think about this question. We're going to take just a couple minutes, maybe 2 or 3 minutes, to think about if you woke up tomorrow and there were no issues with maternal and child health, how would you know? What would it look like? So, boom, none of us have jobs tomorrow. What does that world look like for us? Go ahead and just for a couple minutes, brainstorm, draw, write, think about it in your head. We won't necessarily be sharing these out. This is just to get the juices flowing in your mind.
Also, Melissa, did you want me to read some of the comments in the chat regarding the question about yes, no, and unsure?
Sure.
Okay.
Yes, we can include this. We'll give this 5 minutes now just to include this.
Okay. It would be helpful to see data on maternal mental health and nutrition. We have, I feel like the systemic racism highlighted is a root cause necessarily addressed to transform these topic areas. It would be great to be able to see that threaded through as well. I think we need to focus on the whole family, partner, dad included, not just the birthing people, moms. Would vote that healthy birth outcomes is more overarching category that the other 3 impact directly: nutrition, healthcare access, and maternal mental health.
And we will also be able to pull this chat to have as part of our records as well. So I certainly don't want to lose track of these. These are some great comments. Then just another minute or two to think about that perfect world where we don't have to solve this issue. It's already been solved. What do we see in that world? How do we know that we've succeeded? All right. So now I'm going to share a different screen real quick. If anyone's familiar with Jamboard, it is a Google supported online collaboration tool. We make some slides going across and you will be able to click through. And if you are on a computer, it should just pop open a link on your internet screen. If you're on a mobile device, it might ask you to download an app. If you don't feel like doing that, you'll be able to participate via the chat once you're in your group. So I will switch what I'm sharing. I'm going to make sure I go to the right thing. You know, screen sharing was going so great when we practiced before this. No, it just doesn't want to cooperate. Are you guys seeing a plain white slide saying breakout room instructions?
Yeah.
Yes.
Yes.
Thank you. This is slide 1 up here. This is going to be where you can come back if you forget what you're working on in the small groups. So these are the instructions that you're going to work on. You can, over here, this is your toolbar where you can make a new sticky note if you want to add a little comment. You can add a text box if you want to type. Typing in this is a little funny, so you have to double click on things to make it type. Up on the arrows here, this is how you go side to side. You will be able to select which group you want to be in and which subtopic you're going to focus on. So there are boards for all 4 groups, and you just scroll to the right until you find the one you're working on. And so when you're on these boards, this is your brainstorm area. There's space for up to 10, but if you need to make some more sticky notes, that's totally fine. And so you'll just kind of take one of these. You can put your name or you can just start brainstorming on these sticky notes. Once you all finish that, you're going to share. Each person will go and read through. Then you guys are going to categorize them so you can move them, start to group them together with other similar ideas. And once you have them kind of in loose categories, you can click over to this one where you start to develop those categories into 1 to 3 goals. If you only have 1, that's fine. If you have all 3, that's fine. This is just some areas where you can work on starting to formulate those into goals. And so you just keep scrolling through until you find the group that you're in. So any questions about how that will work? A couple of us will be popping through the breakout groups just to make sure things are working and there are no questions and you guys are able to be working through the conversation. So let's see here. We will go to 5:15, I believe.
And I have all those breakout rooms ready.
Perfect. If we don't have any questions, go ahead and launch those breakout rooms. Again, you should be able to see the subtopics and pick which room you want to go to.
And if you are having trouble going into a group, I can also move you in there. There's also one person in nutrition.
Like Erica needs to be moved.
Okay. Erica, what group would you like to go into?
Healthy birth outcomes.
Also, Kong and Cameron, you guys are welcome to participate at this point. Marlene as well.
If you are unsure of where to go, or nutrition still only has one person.
Yeah, you can put me in nutrition.
Okay.
Yeah.
The various WIC folks weren't able to make it today.
Okay, that makes sense. All right, so we have 10 people in healthy birth outcomes, 5 people in access to reproductive health care, 3 people in nutrition, and then 4 people in maternal mental health.
Sorry, could you say that again?
Yep, 10 people in healthy birth outcomes. We have 5 people in access to reproductive health care. We have 3 to nutrition, and then 4 in maternal mental health.
So Melissa, when you shared with me the screen, I think you shared all your rights because I see the breakout rooms.
I did make you a co-host, so that might be part of it.
Maybe that was the issue. But I get to see the cat.
Yeah, I think I also I think leaving my PowerPoint, it got stuck in presenter mode even when I wasn't sharing anymore. And so that made everything a bit weird. It's like Lindsay's back. Hey, Lindsay, at what point did you drop out of the meeting? Did you hear the breakout room summary?
I did not. My Zoom keeps closing on me.
Sure.
I'm sorry.
That's okay. So we're doing some breakout rooms. The topics are healthy birth outcomes, access to reproductive health care, nutrition, and maternal and child health. Are you able to see the chat?
Yes.
Did we put the link to the Jamboard?
I don't see it in here.
If we put it in the chat now, will everyone see it?
You have to broadcast it, right? Not if you, I don't think they'll see it if you put it in here. I think you have to broadcast it. Alex is talking, but you're on mute.
I'm broadcasting it right now.
Oh,
thank you.
That was probably my mark, so I apologize. I was moving people to breakout rooms.
So Lindsay, the ones with the least people right now are nutrition and maternal and mental health. Would you like to go into either of those? If you're talking, oh.
No, my dogs are barking. I saw Alex's
I know that feeling.
comment come up, but then
I'm not sure it's clickable when you broadcast it. I think we have to go into the rooms.
I'll go into each room.
Thank you.
Oh, thank goodness for Alex, for sure. I would not know how to do half of this.
Yes.
Oh my gosh. So is there one that you'd like to go to, Lindsay? Any of the maternal mental health or nutrition?
So, maternal mental health, I guess. I can't see what Alex sent. Like I saw it pop up, but it wasn't in the chat. So the
Oh,
Jamboard.
I'll put it here.
yeah.
Just because you might not have the chat once you get into a room. I know chat is not always contiguous with breakout rooms.
Oh, okay.
So am I just supposed to pick one of these that has?
No,
like
I can assign you.
nutrition or-
We can.
Okay.
We can assign you to. Did you want nutrition or maternal mental health?
Mental health.
All right.
So when you click
send you
that
over, see if I did
Jamboard
this
link,
correctly.
there are little left and right arrows up at the top when you click the Jamboard link, and you'll be able to just scroll over. Page 1 will have your instructions, and then scroll over until you find the maternal mental health slides.
Okay, cool.
All right. I'll send you over.
Thank you.
Did that work? Yay! I figured one thing out since out of myself. Oh,
There is lots of stuff.
You're doing a phenomenal job. Phenomenal. It was great.
Considering I have 2 whole screens, but like my PowerPoint ended up on both screens, so I'm like, okay, I guess I just won't have my notes.
Yeah. No, you did good. It's the when you clicked on the where you wanted to switch it, you accidentally clicked on duplicate.
Yeah, which I thought is what I did while we were practicing beforehand, but
No, you do switch.
Whatever. It worked.
Yeah, yeah, glad it worked for the better. Yeah, sometimes I don't know why the screen share tab blocks some of like the important stuff on the screen.
Yeah, it
I don't
blocks
know.
everything you need.
I thought you are able to move that tab around if you hold it, but I don't remember that was a thing.
Interesting.
It looks
I might
like
try that.
Yeah, it looks like the Jamboard is working because people are adding notes. Just checking in on that. So.
Oh, great. So what we can see, if we click on that link, we'll see everybody's feedback on that one.
It'll be updated real time.
Yep, it's a shared board, so we should see it actively going.
I'll pull it up.
Sometimes it's a little slow to load. And then, yeah, you just use the arrows up at the top to scroll through the boards.
Ooh, I wonder what those who don't have, like Healthy Birth Outcomes has 8 people in there, but there's 5 boxes.
If you click to the next one, there are additional
10
slides.
Oh, okay.
I hopped into the Reproductive. I didn't have anything on their Jamboard, and I asked if they needed any assistance, and they said that they got it open. So I think they're just having a little bit more of a discussion before putting down the.
Sure.
Nice.
Yeah, I can see that there's activity, but yeah, there's only one thing on a slide right now.
For
Or on
whatever
a
reason,
sticky note.
I don't see the arrows. I don't get arrows.
They're all the way at the very top. Do you see the little line of bubbles with like different animals indicating there are people sharing the board? So it's in the middle of that row.
Ah, I see. Got it.
Yeah, they're kind of subtle.
I thought I remembered you doing that at the ends, obviously. I was wrong. Just looking through the list.
And then Alex, were you able to check in with the other groups? Are they?
Yeah. So they all, what I think I worry about is I think everyone are really passionate like on their expertise. And so like when I was jumping in the conversation, it seemed very I don't think everyone shares the same action. So I think it's going to get a little harder to come up with those like collective action items. It seemed like really great conversation. So I'll be curious to see where they go,
I might broadcast something like if you keep your goals broader, we'll be able to generate a variety of interventions.
Yeah, I think that would be smart.
Yeah, there's only a few that are documenting in there. Reproductive healthcare. Even nutrition is having stuff. That's great. Looks like they're doing it as a group.
And
So I
that's our
said-
smaller group. So I think that's really helping them as well.
Yeah.
I said you can keep goals broader if that's easier, so that our interventions can be more specific to the expertise on this team.
Yeah, these are great.
Sorry, I fell off.
No, you're good. Is there
Which
any?
room?
Yeah.
Which room were you in?
I can go back. I was in the healthy birth outcomes room. So it looks like I can join back. Oh, hey, you're on it. Thank you.
You're welcome.
You are so good at this, Alex. I can see you're like.
Thank you. I led the Mix App Coalition all throughout COVID virtual time. So I had to get it down because it was all virtual meetings.
Oh, very cool.
So at least that was a really good skill that came out of that.
Oh, that's great. Yeah, no, clearly you are proficient. I think we use so many different ones. I've never become, I've not really become proficient because we just tried different things. So too many.
There's so many options for a virtual meeting.
I know. Tend to be a little bit, no, I don't. I was gonna say, I tend to be a little bit better in this one, but I'm like, no, not really. Usually somebody else handles that. So thank goodness for people with that skill. Should we, do you want me to go into any of them, Melissa?
I was
Or do
just
you want to
thinking
just
if
wait it
we
out
should.
and then they're just gonna share?
You can go through if you want, Rosa Maria, and see if anyone needs some help with discussion or help kind of focusing in on how to start generating goals.
Yeah, it looks like the access to reproductive health care.
Or what we could do too is you want to send out a broadcast that now is probably a good time to start like clustering them into.
Yeah, I was just about to start typing that up.
Oh.
That was the other tricky thing when my share screen was being weird. I couldn't see my clock at the bottom. So I was like, well, I hope I'm on time.
You're doing great.
Yeah, I think this is going really well.
Yeah. Taking into consideration, people just joined with this storm. I thought we were going to get so many less people.
As I said, start moving towards grouping your ideas by theme or category. There's 10 minutes left in small group time.
Great. I'm gonna join. I don't know how to get out. Once I'm in, I hope I keep this breakout room box that I have.
So you will still have that, and then when you're ready to come back here, you would go to leave breakout group, and then there's another question of leave meeting or leave breakout group, and then you go to just leave breakout group.
Okay. All right. Wish me luck.
You got
jump in. Thanks.
Let's see, where did she end up? Nutrition.
Yeah, I just think everyone is so passionate in what they do. And then one I hopped on this, she was talking, but there's a lot in the background. And everybody was like, oh, we can't really hear you. There's a lot going on. She's like, you can hear that? And everybody was like, yeah. She's like, it's my dad and sister arguing about politics.
Oh God.
Yeah.
At 5 in the afternoon. Like,
Yeah.
on
I
a
was like,
snowstorm.
Oh,
like, it's too late in the evening to be talking about this.
That's a lot.
Like, man, what sparked that? I wonder what sparked that.
Yeah, something.
I'm glad I went with the headphones because
Mhm.
during the presentation, someone was like snow blowing or something like right next to me.
Yeah, Tyler's out there still blowing now, so I hope it wasn't too loud.
Alex, do you want to pop into some other groups and see how they're doing?
Yep, I could do that. I'm gonna pop into access to reproductive health.
Melissa, is this the only breakout session for the meeting? I don't remember.
Yes.
Okay, good.
Yep. So they are going to, once they finish up here, we're going to come back, do a large group report out, and then wrap it up.
Man, time is flying. It's already been an hour past. Yeah. Wow. Okay.
The built environment action team was this morning, and theirs was only an hour and 15 instead of an hour and a half. And I was able to join that, and it like flew by. So after that, I was like, okay, this should go pretty fast then.
I realized I should have stopped the recording. I can stop the recording and start it back when everybody rejoin. Well, it's only 2 more minutes left, right? So it doesn't.
Yeah, it's going. It's just going. I kind of thought that the recording stopped automatically when you split up into breakout groups.
No, it does not. That's something you have to manually do. Or you can pause.
Does it like only record like this right now, or does it like record the breakout groups?
I'm pretty sure it doesn't record the breakout rooms. I think it's recording us now.
It would be real convenient if it recorded the breakout rooms.
But then that would be like technically 5 different recordings at one time.
Yeah,
it would have to save them.
That would be a lot.
Because that's like, plus I haven't recorded Zoom. I mean, there's a lot. So I don't remember if it records just the screen or my whole like tabs. Because like right now I'm in I have it where my chat is popped up and I can see the participants. So like, if I play back the recording, will it just show me my screen I recorded, or will it just show like the video of like?
I think it only shares like the Zoom screen. Like I don't think it'll record the chat.
Yeah, okay, that's what I thought. Okay.
But we should be able to access the chat log afterwards.
I believe so. If anything, I can, because you're going to be the one who closes the meeting. So even if we can't save for some reason, I'll just copy it just in case. I think.
Yeah. After the FEMUR meeting, I didn't even have to do anything. My like downloads screen just opened and it just had a little file called like chat log or something. Which was convenient.
Yeah, super convenient. And I know it sucks because not every like if you have like the free Zoom, you don't get that. So I learned that the hard way.
You don't get
you don't get your chat log saved automatically.
So you gotta like highlight the whole thing, copy and paste it.
Yep.
Ooh, that alone is worth whatever payment you gotta do. I didn't even have to say anything into that group. It was very, they were talking throughout. I was like, okay,
Oh, that's
I didn't say
great.
anything. Yeah. It's mostly one person, but I think one person talking, but still.
I just broadcast that there's 5 more minutes.
I don't know, Melissa, if you want to hop into the access to reproductive health care. They don't have any goals set, and I said something. I don't know if they're kind of struggling to coming to a consensus. I don't. It seemed like
they've got ideas on the board now, so
Yes.
that's at least good. Like if necessary, like I don't know, me and Rosa Maria or whoever can work together and kind of start to form them together.
Are they talking though, Alex?
They are. It seems like every time I hop on, it's one person kind of dominating the conversation. But they are talking, if that counts as talking.
I had the same thing right now when I went to the other one.
I've also been the person, right, that's been in a group where nobody talks, and then you have to be the one who's talking. You know what I mean? So it's
yeah.
It actually does look like they're starting to work on the goals
Oh,
board.
good.
And so they
Yeah,
put
I
some of their
was
themes up at the top. That actually looks like a good way to do that.
Okay,
I didn't even think of that.
For access to reproductive health care?
Mm-hmm.
You only see their names still.
If you go to slide 7 on the top, they change the names of the goals. There's education and coordination of care.
I see.
Yeah.
Ah. Nice.
Yeah, so at the very least, if we need to use their notes to generate some goals, they pulled out those themes, and those look like good themes.
Yeah. So for the next meeting, the areas that we had 0 in were social services, which I think is a pretty important area, given all the social determinants of health and the big pieces of reasons for why maternal and child health outcomes are not the greatest, I think. And then the other one was advocacy.
And I
That
think
was the area that, but we're really heavy in government.
Yeah, and
This is a lot of
Sumaya
work
might have
stuff.
put Sumaya probably put government because she's with the county, but like she's focused on coordinating services offered by the county DHHS. So she's kind of a social services program. And yeah, I think some of the folks who just aren't able to be here might fall in that category as well.
Community as well might be another area we can try to promote the community members. I don't know how you feel about advocacy, but I do think social services and that should be more represented in here. I don't know what area, who that would be.
I even think, like you said, community members in terms of even like mothers or people who have had children or are currently pregnant to be a part of this conversation would be really important, that are outside, like are not doing this just because of like work, nobody's doing it just because of work, they don't.
Yeah.
Community members.
Yeah. But we don't give incentives, right, to
this one. There is, right, Melissa? A $45 gift card if not during work.
That one, I don't know when we're going to implement that. So like, I know we talked about it and I just don't know like how we do it, how we know like who is eligible kind of thing.
Do you want to do a 1-minute broadcast?
I actually already sent that out and that was probably about a minute ago. So if you want to,
do you want me to close the
start
rooms?
pulling them back in.
I could close it. close my rooms.
Give
Hit
like
the
a
break.
30-second warning. Is it possible to choose how long?
Yeah, you could choose. I think you could choose. That's weird. Yeah,
You
you
could
can
choose?
say like a minute.
Oh,
They're coming back in a
only gave
minute.
me 60 seconds.
That's all right.
I mean, they
I
could.
gave them a
Mhm.
I gave them a 1-minute warning about a minute before this, so hopefully they were already wrapping up some of their conversations.
This is like the first time I've seen Zoom from behind the scenes like this. Pretty interesting.
And actually at one of the last slides 14, I have boxes for just each of the subtopics. Is someone able to go and just kind of take the notes that we report out?
Sure.
Here we all are. That should be all the groups. Hello, hello. I was watching those jam boards go, so I always like seeing more and more sticky notes pop up and get filled. I realized that maybe not all the groups got to formulating specific goals, but I am keeping this jam board, and so we'll be able to take your notes and start to put them into some kind of goal forms. Those of you who started the categorization or theme identification, that's really helpful. So we'll be able to go with that and kind of take everything you've written, start to form some goals, and then we'll bring those goals back to the group at a future time to start, making sure that we're on track with it. And then again, the goals are more high level, they're kind of guiding, but if we want to do some specifics that aren't necessarily explicitly laid out in those goals, as long as it can fall under there, we'll be able to still have space to work around with our interventions when we get to the point of brainstorming those. So if we want to start with, I'm trying to look at my time, I want to try to keep us a little bit on track. So a little bit quicker than I had maybe planned, a person from group 1, that healthy birth outcomes group, to kind of report out if there were any significant points of discussion, or if you have 1 to 3 goals you would like to share. Let's try to keep it to 2, maybe 3 minutes for each group. So who is in group 1? Yellow sticky notes.
I can start, and then I think my team can lift us off. I think one of the ideas that we coalesced around was Medicaid reimbursement for doulas that pays a living wage, and that we need to obviously enact policy change for that to happen, but we can leverage our collaboration around this work in order to get that policy change in place.
That's great.
Yeah, and then I think the primary care, the community health network and support, and finding a way to embrace, but having the local care around the corner. And then we also, or at least a little bit into the clinical area, perhaps, that good birthing experiences, lower C-sections, babies at birth, at weight, things like that. So it's more clinical measures, perhaps.
And then
And make sure I captured that one of those items correctly. Is that primary care, community health?
Yeah,
embrace
so
having local
yeah,
care?
good yeah, like primary care, healthcare around the corner, really, at your corner store almost. So in the community, and then the clinical measures, babies at birth, lowering C-sections, that people have access to doulas as well as to breastfeeding consultants to really have the healthy outcome happen.
So you were group 2, correct?
No, I was still in the healthy birth outcomes.
Still in the healthy birth outcomes.
Yeah,
Got
we just
it.
broke it down a little bit.
Thank you. Again,
I'm
that's where there's plenty of overlap.
I'll just add to that of we were looking at how do families become more wrapped around just more naturally and intrinsically and warm handoffs and like that it's an assumption and a built-in practice of be it you're in a clinical space, but how are you automatically given home visiting doula, whatever it is going to like see families through and really surround them both inside the acute, type of clinical spaces as well as out in the community in real life. And because there's a lot of things that aren't closing that gap of that, birth to 1 year window for really talking about healthy birth outcomes. So, to Akneel's point of what are we doing as a community and referral pipeline and workflow type of processes that we can help in healthcare spaces of like is built in and automatic and not contingent on a brochure or the client following through on their own type of practice.
Sounds good. And we will go to group 2, access to reproductive health care. Either your big report outs or if you want to let us know some goals you were working on.
I can share. We kind of fit our thoughts into 3 goals. The first one, just education and stigma. So making sure people know where they can receive services, what their options are for paying, starting conversations more at home, increasing education in schools, just conquering the stigma that still exists with talking and going to get healthcare, reproductive healthcare. The second one, coordination of care. So really, I think overlapping with what group 1 just said, really more coordination between agencies and care beyond referrals, streamlined coordination, agency to agency, meeting people where they're at in creative ways, whatever that means. And also just making sure that providers are, that providers are getting what they need and patients are getting what they need, high patient satisfaction. And then the third goal we talked about was, really deeper inclusivity. So guidelines and recommendations that are inclusive and appropriate care for all different people, all different ages, all different backgrounds, just fully appropriate care in this realm. I don't know. Am I summing it up? Okay, group.
Nice job. We talked a lot about a lot of different things, but just really, trying to make that care more comfortable, more ingrained in our community, that this is the care that's important, and making sure it's that places are within communities that are warm and accessible and welcoming for people.
And group 3.
I can share out since I'm still looking at the Jamboard. The 5 goals that we talked about was improving healthy food access, healthy food education, creating a nutrition counseling partnership between some academic institutions in Milwaukee and families in Milwaukee, improving financial support for healthy food access, and the main program we talked about to do that, it was a food as medicine program. And then also we talked about the idea of sustainable food sovereignty.
That's great. And there can certainly be crossover with our built environment team that has food and food access as one of their big priorities within that action team. We were supposed to have a couple of WIC folks on the call. I think one from internally, possibly 1 or 2 from another organization, and they just weren't able to make it tonight. So hopefully in the future, we will have some more WIC representation to help with that nutrition aspect as well. And we will go on to group 4, bring it home.
I can go. So we ended up talking about connecting caregivers and just increasing support overall for people who are pregnant. That could look like peer support specialists, community health workers, just kind of thinking through alternative ways to provide that support to people. We also talked about the need just to build awareness of maternal mental health. Let's see what else, particularly culturally appropriate care, just overall increasing resources as well as increasing participation in the resources that we already have. We talked a little bit about how to connect those goals to policy and system strategies. So that could look like paid family leave, increasing insurance coverage, or increasing access for people who are uninsured.
That's great. Thank you so much for all that. So again, as a reminder, these are drafts. Rosa Maria, I know you've been putting it on the Jamboard there. Thank you so much for that. I've also been taking notes. So if you weren't able to capture everything, hopefully among those of us helping facilitate this, we'll have those notes. We're also going to keep these Jamboards. So we'll keep all of your direct sticky notes and everything like that. And we will kind of workshop those into some clear goals, and then we'll go from there. So going forward, again, we're going to take these goals once they are smiths a bit clearer. That's where we're going to develop some objectives, some intervention strategies, and from there, some partners for implementation. And so those objectives and interventions is where we can get a bit more granular. I know that it can be hard when we're all coming with our different perspective and expertise. We want to focus on kind of our thing, and it can be hard to generate these goals together. And so that's our opportunity to get more specific, is when we get into those objectives and those interventions, we'll be able to have more of those. And so again, those are going to come in future meetings. So any quick questions following that goal setting activity? Any final clarifications? Does anything jump up at anyone like no, or something's missing, you know, any objections? Otherwise, if there are no real objections, we're going to go with a general thumbs up consensus around the discussion that just happened. Any thoughts there?
Can I ask a quick question? If we're in this meeting now, are we in the action group, or do we have to sign up to be part of that?
So that is in some of our next steps. I have put all you guys on my email list to be part of the action group. We are hoping for an organizational commitment for each of your organizations for 2 years, and then we'll kind of reassess at the midpoint, and then that final 2 or 3 years, because we are hoping for some consistency and representation. But we're looking at the organizational level because we know that job roles change, you know, you change organizations, things happen, your capacity changes. So if you need to delegate your coworker to come instead of you, that's totally fine. We just are hoping for that organizational commitment. And so some of the more official stuff in those terms is going to be coming down the line a little bit. And then some other next steps, I will do this screen share thing again. And are you seeing a PowerPoint?
Yes.
So again, it's still kind of forming a little bit, which means that folks might be missing from this room. Like we saw with that poll in the beginning, we may have kind of different levels of representation from the different types of organizations. So maybe we need some more folks from advocacy groups, or maybe some more social services oriented folks. If you think you know additional partners or organizations, you can put those in the chat. Otherwise, this is my email here, mseidel@milwaukee.gov. You can email me. You can also share this MKE Elevate@milwaukee.gov email address. That is the hub, the contact hub for MKE Elevate as a whole. So you can send that to your networks or folks that you think should be on this action team. They can email that and get signed up. Notice that's going to be 2 E's in a row, MKE Elevate at milwaukee.gov. And then there is a sign up link. Alex, I think that's at the bottom of our list of things to drop in the chat. If you are not getting the monthly newsletters from MKE Elevate, there's a spot on our website. You can click sign up here. You'll start getting the monthly updates. Those are separate from the action team specific ones. Those are going to be more about MKE Elevate generally, rather than the specific action team. And then again, there's a steering committee that's going to be meeting. And then there are going to be some other meetings, general team meetings. So those are for folks from different action teams to come together. And then also infrastructure work groups. So there's going to be a group working on policy, a communications infrastructure group. So kind of more technical things like that. Those are going to be quarterly meetings and kind of offset from each other. So hopefully there's not going to be 4 meetings in June or whatever it might be. Hopefully those are going to be spread out. So it's more like 1 meeting per month, depending on what level of engagement you're at. Right now, Rosa Maria and I are kind of acting as co-chairs of this action team, but we would really like a non-MHD representative to also be a co-chair. So if you think you or a colleague of yours or someone you know is interested in kind of taking a little bit more of a leadership role with us for this action group, someone who's got, you know, some expertise or is just particularly passionate about this, if you or someone you know is interested, again, those email addresses right there, you can just send me or the MKE Elevate email a message just expressing your interest. This isn't a commitment at this point. We just kind of are hoping to get someone outside of the health department represented as well in one of those chair seats. So, scrolled it too far. Another quick poll, Alex, if you're able, just to get us kind of a pulse check. Does this type of scheduling work? 3rd Thursday of the month, every 3 months. So the next one would be May. The one after that would be August, and then November. This isn't binding, but we do have to try to figure out ways to schedule these. So, you know, this evening, 3rd Thursday, is this kind of a general thumbs up, or what are we thinking?
Right now we're at 100% yes.
Love it. Love to hear that. One more very quick thing. I have to plug it. The Black Birth Symposium, Saturday, March 25th. I was at the fall event, and this is an extremely worthwhile all-day Saturday event. It is just very inspiring, full of extremely passionate people. The website here, Alex, if you want to drop that one in the chat as well for folks to be able to click on that. It's hosted by Milwaukee Film Festival. The panel looks very good. I'm very much looking forward to them, and the registration is now open. It always feels really cheesy to say it's a great networking opportunity, but I have gotten directly involved with at least 2 projects as a direct result of that fall event. So I would highly recommend, if you are interested in maternal and child health, and particularly these health disparities, seeing if you can get this event on your calendar. It is extremely worthwhile. Thank you so much. I'm gonna stop sharing, come back to you guys. Thank you so much for being a part of this. Hopefully no one has to be driving anymore today. We're all safe at home, fingers crossed. Any final questions, comments, concerns? Need to raise a hand, throw it out there. Otherwise, that is all I had for you guys today.
Thank you, everybody, for joining.
Thanks.
Thank
Have a
you.
good one.
Thank you.